Greetings, my name is Megan Hansen. I am here with Dr. Vivian DeNise, and we are speaking to you from Patients Medical. We're a holistic medical center in Midtown Manhattan. We're on 2nd Avenue and 42nd Street here in the Big Apple, and we are going to be speaking with you today about the truth about bioidentical hormones. So what does that mean? There's so much information out there about hormonal replacement therapy, synthetics, bioidenticals, lots of different options. So we're here just to kind of dispel any myths around hormonal replacement and really give you the information that you've been looking for from somebody who's been doing this for years extremely successfully and is a doctor in the field. But first I want to talk to you a little bit about Patients Medical, who we are and what we do here at our Holistic Medical Center. We are a full-service holistic medical center. So what does that mean? We have doctors that are many different specialties. We also have internal medicine, family medicine. We have some spa services. We have craniosacral therapy and kinesiology. And I'll kind of show you the different practitioners that we have in just a moment. We also have state-of-the-art diagnostics, including ultrasound, bone density. We have very detailed blood testing that we do here, and many other different types of tests that our doctors use to help you figure out what would be the best treatment protocol for you. Our motto is Discover Health, Rediscover Vitality. So what does that mean? I get that question a lot. People, especially in New York, walk around feeling so miserable every day, and they don't even realize that they're feeling miserable until they come to our doctors, who actually help them get much better balanced. And then they realize that they have this renewed energy and zest for life that they didn't have before. So every day we walk around, we might wake up feeling tired, not having slept well the night before, needing some sugar and some coffee to get going in the morning, not feeling optimistic about our day. It's exhausting to walk up the subway stairs or down the subway stairs, and then, by the middle of the day, you feel like you could really use a nap, possibly not being as efficient as you could at work or not really enjoying your work, and then at the end of the day feeling so exhausted or ill from all of the things that you consume during the day just to keep yourself going, that you don't have time to exercise or connect with loved ones or take your dog for a walk, cook yourself a healthy meal, and possibly have some wine to relax from the day, and then suddenly you are trying to lay down and you can't sleep even though you're so tired because you are feeling unbalanced still. And the cycle perpetuates itself. So our doctors help you in a variety of different ways figure out what sort of imbalances you have, and then once they're able to get you balanced, you are surprised because you wake up feeling like you have a lot of energy and you're optimistic about your day, and you're able to make healthy choices and plenty of energy for exercising. So you're really rediscovering your life. You're rediscovering your vitality once you are able to discover your true healthy self. Our doctors focus on the root cause of symptoms. So instead of just meeting with you briefly and speaking about your symptoms and handing you a prescription and telling you good luck, they want to know why the symptoms are happening. So what that means is they do the diagnostics to figure out exactly where the imbalances lie, so that when they balance your body, then the symptoms just kind of naturally go away. Our goal is to promote healing and prevent disease. So what a novel idea in this age of, take a pill and the symptoms go away. Actually preventing the disease before it happens, as opposed to waiting until you get sick and then having to deal with the consequences of that. Our physicians, they all speak to each other, which means that when you see an internal medicine doctor here as well as specialists, they collaborate to create a treatment protocol for you that works for all of your medical needs. The result is to gain health and nutritional wisdom that can be applied for many years to come. And that's not just for you, that's for your entire family too. So our doctors are talking to you about lifestyle upgrades, about your nutrition, about just how to lead a healthy, well-balanced life. And that can definitely help relieve symptoms that you're having if they're acute, but also it's something that you can use for the rest of your life every single day. So you get lots of bang for your buck out of these office visits with our doctors. Our founder is Dr. Warren Levin, who began practicing his holistic protocols in 1974, and then our medical director, Dr. Rashmi Gulati, began studying with him, and when he moved out of state, then Dr. Gulati took over his practice, and it became what is now called Patients Medical. As I said, we're on 2nd Avenue between 42nd and 43rd Street in New York City, and we're very proud that we now have an entire floor of holistic medical office space with many different offerings for different types of medical and wellness concerns. The conditions treated here are many, and this is a very, very short list. Chances are, if you have any sort of condition at all, we can probably help you in one way or another. So just give us a call, and I can explain to you better how, but this is a short list here. Our staff include medical doctors and doctors of osteopathy that cover internal medicine, family practice, gynecology, oncology, alternative pain management, pediatrics, plastic surgery, nutrition, kinesiology, craniosacral therapy, reflexology, and Reiki. We have oriental medicine and acupuncture and homeopathy, and many, many other things as well. So give us a call or check out our website at patientsmedical.com to read about all of them. So I believe that we have here what is the true definition of integrative medicine, so combining the best of conventional medicine with the best of holistic medicine to give you the healthcare that you are really looking for. And now I would love to introduce our speaker, Dr. Vivian DeNise. She is an integrative medicine physician who specializes in bioidentical hormones, among other things. She completed her medical degree at the New York College of Osteopathic Medicine. Her certifications are in integrative medicine with the American Academy of Anti-Aging Medicine, better known as A4M. Her specialties include, as I said, hormonal imbalances, nutritional deficiencies, thyroid disorders, gastrointestinal problems, detoxification, and many other things. And now we're going to talk about the truth about bioidenticals, and I'm actually going to turn it over to Dr. DeNise. If you hear a little bit of traffic noise in the background, that's just New York City for you. So we'll do our best to make it be not too conspicuous, but just bear with us if you hear any external noise. All right, Dr. DeNise, I'm going to turn it over to you.
Good morning, Megan. I would just want to say from the beginning that I hope the listener comes away with a thorough understanding of why using bioidentical hormones are different than synthetic and the importance of them, not only for increased libido, not only for relief of menopausal symptoms, but for your overall good health and longevity for men as well as women.
Oh, that's true. You know, when we think of hormone balancing, we always think of women, right? The PMS, the GMDD, the menopause, but this is very real for men, too. This is something that they should really have a closer look at if they've never thought about before.
Absolutely. There are estrogen receptors everywhere in the body for estrogen, progesterone, and testosterone, again, in both men and women. And some of these receptor sites are located in the brain, bones, muscles, joints, heart, blood vessels, bladder. As you can see, the heart, it becomes very important for men especially because they tend to lose their testosterone or decrease their testosterone starting in the early 40s. So that's been thoroughly associated with heart disease in the early 50s. For men.
And even just maybe being uncomfortable, a little bit of depression. Are there some other symptoms that go along with that loss of testosterone?
Sure. There's actually more bone fractures. There's mental fogginess. Mm-hmm. There's loss of libido. There's tiredness. There's fatigue.
A lot of things to think about.
And our goal is to achieve balanced hormonal optimization to that of when you were 25 or 30. And why do we pick that age? Because that's the peak age of optimal hormonal levels. And the incidence of disease is at its lowest. No coincidence.
Wouldn't we all like to feel like we were 25?
Right.
With, of course, with the wisdom that we have now.
I just want to digress here for a moment and speak about xenohormones. Xeno is Greek for foreign, and xenohormones are also called endocrine disrupting complexes. They are serious environmental hazards not only to our wildlife but to humans as well. For example, PCBs were used in paints and adhesives and caulking, and they're no longer used in America today, but they're also not biodegradable, so they still are very much present in our environment. Also, the use of pesticides are still prevalent in our country, and there are some pesticides that are no longer used, such as DDT, but they are used in third world countries where a lot of our produce is still coming from.
Yeah, that's right. So what are some of the things that we need to watch out for from other countries that could contain these substances?
Well, believe it or not, most of our supply of apples come from China, and China does still use DDT.
Wow. Everybody eats apples. Apple
So,
pie. Apple pie.
So that's why you really want to buy local as much as you possibly can.
Absolutely. And we have a downloadable on our website, too, under the resources about where you can find xenoestrogens. So if that's something that you're concerned about is these toxic substances, download the Where Are Xenoestrogens on our website, patientsmedical.com, under resources.
And also, you know, when a patient does come to us here at Patients Medical, we also talk about their nutrition and like how to fight back against the xenoestrogens. You could use cruciferous vegetables, you could use flax, you could use beans, and these would all work.
Right. So even if you know that you've been consuming xenoestrogens, don't worry. There's things that we can do to balance it out.
Right. So what are bioidentical hormones? They are atom for atom identical to what your body makes. There is no increased risk for cancer. There is less of a risk for heart disease and less mortality. They're needed for bone, brain, and for your total quality of life.
And why is there a decreased risk of cancer with the bioidenticals as opposed to the synthetics? You're talking about atom for atom.
Because synthetic hormones kind of fit into your receptor sites and give your body a similar message, but not an exact message. And it makes your body react in a similar way, but not an exact way to your hormones.
Okay, so there's some waste there that's probably toxic.
Exactly.
Okay.
And all your hormones work as a symphony. The one thing I want to mention on this slide is note that vitamin D, we used to think of it as a pro-hormone, and now it has been elevated into a full hormonal status.
All right, that's good news, right? Vitamin D now a hormone. It probably gets the attention it deserves, finally, huh?
Absolutely. This slide is just to demonstrate how all the hormones kind of interact with each other. Even your thyroid and your cortisol levels of your adrenal glands play an active part. And it all starts as cholesterol. So you never want to be on a no cholesterol diet. You know, low cholesterol, being mindful of the amount of cholesterol. But cholesterol is very important for us, especially for children, Megan.
Really? We always think, you know, try to cut the cholesterol out, but that's not good at all.
Well, it's in proportion. Everything is in proportion.
Okay. And for more information about exactly what is the best amount of cholesterol to have, see the doctor.
Absolutely. So these are the female hormones. There's three kinds of estrogen in your body. Estrone, also known as E1, estradiol, known as E2, and estriol, known as E3. Estrone is the female hormone that's been mainly associated with illness and disease, whereas estradiol and estriol are the good kinds of estrogen. And then there's progesterone and testosterone. This slide is just showing how all the hormones interact again. This is a slide of a woman's menstrual cycle, and it shows how the estrogen goes up, the progesterone's going down, and the flow of things.
Good to know. So women, if you're not familiar with this chart, you probably should be. Speak with your doctor about what that means for you.
I think we all know the definition of PMS, but I especially love this slide.
I'm fine. I hate you. I love you. I want ice cream. Come here. Get away. I don't know what the orange is about. I'm not sure. She probably doesn't either.
So what's perimenopause? It actually can begin 10 to 20 years before you even start having menopausal symptoms.
Wow, that's a long time.
There are early changes where they'll come, they'll go. Maybe even PMS is considered a perimenopausal symptom.
Really?
And then in the middle, changes are coming more often for longer. Maybe you're starting to have a little bit of difficulty sleeping, or maybe you're feeling a little anxious. And then once you're into or very close to menopause, that's when the changes are usually, you're always having hot sweats, you're always having flashes, you're exhausted.
And then finally, no menstrual bleeding for a year.
That's when you're technically in menopause. So progesterone, a decrease in or an imbalance in progesterone is usually related to poor sleep, anxiety, or PMS. Testosterone, women most certainly need testosterone in their bodies, and it is one of the primary causes of a low libido, as well as a decreased memory. So when you start getting into menopause, you start like not being able to be, you don't feel as sharp. There are some women that actually worry that it's like an early Alzheimer's, and it's really just that their testosterone is decreasing. And the estrogen, we all know, vaginal dryness, hot flashes, low energy.
All right. So also Dr. DeNise has another webinar about libido and hormones. So if libido is a big issue for you, after you finish listening to this webinar, go and listen to her webinar on libido and hormones as well.
So what does bioidentical hormone replacement do? It rebalances estrogens, progesterone, and testosterone for your individual body. It's not a one-size-fits-all. It's not they just take it off the pharmacy shelf and give it to you, and however it works for your body, well, okay. We actually compound it with a pharmacist exactly according to your lab work. Not everyone needs estrogen. Not everyone needs progesterone. It depends on your body and what you need.
So get hooked up with a doctor, get tested, and figure out exactly what your body needs.
So these are just some examples of estrogen deficiency. Hot flashes, night sweats, fatigue, vaginal dryness. Also here, poor memory is associated, and low energy. And here's more. Decreased sexual desire, increased stress, incontinence, and frequent urinary tract infections, osteoporosis, cardiovascular disease, dementia. These are side effects of excess and estrogen. And sometimes women can have excess estrogen on their own because of the xenoestrogens that we were talking about. There are also other reasons, but I don't want to go into that. But this is what they can cause. So cause. So if you're feeling agitated or anxious, or your breasts are swollen, or you feel bloated, or you're getting breakthrough bleeding, or you're just very achy and you don't know why, it could be a reason of having too much estrogen. These are what some of the things that synthetic estrogen, such as the pill, the birth control pill, will cause. It could cause your blood pressure to go up. It'll increase your triglycerides, which now is more an indicator of heart disease than even cholesterol. It increases estrone, which is what we were talking about before. It's not the kind of estrogen you want in your body. It causes gallstones. It increases your liver enzymes. It also increases your sex hormone binding globulin, which attaches bioavailable testosterone, which means what you do have is not able to be used by your body. And it interrupts your tryptophan metabolism. Tryptophan is very important in metabolism of serotonin. Serotonin is a neurotransmitter that is very important in sleep, mood, and appetite. And low levels can cause depression, sleep difficulties, uncontrolled appetites, headaches, and hot flashes. And synthetic estrogens also cause blood clots to form, whereas bioidenticals do not.
Interesting. So there are a lot of side effects of the synthetic estrogen. Why do people keep choosing this? Why do doctors keep recommending it?
I think because they don't have any they don't know of their alternatives.
Okay. But we have some great alternatives. And that's what we're here to
Far
talk about
superior.
today. Mm-hmm.
So what is transdermal estrogen? Transdermal estrogen is mainly how we deliver bioidentical hormones, and it comes in a cream, and you rub it on once a day, usually, but every patient's individual. And this is what it does do. This is the bioidentical cream that you would get from us. It decreases your hemoglobin A1C, which is the average. It tells the physician what's your average sugar over the past 3 months. It decreases your total cholesterol. It decreases the bad kind of cholesterol. It decreases something called your C-reactive protein, which is inflammation. It decreases IL-6 and TNF-alpha, which are inflammatory particles associated with autoimmune disease, cardiovascular disease, Alzheimer's, but there is no increased risk of stroke or clotting. And it also protects against bone loss, so your level of osteoporosis is diminished.
So for the people who are currently on synthetic estrogen and are maybe experiencing all of those problems or haven't yet but don't want to wait around and figure out if they are going to get those problems, this is a great alternative.
This is far superior.
Mm-hmm. Okay, great.
Progesterone is usually the first hormone to become deficient in peri-menopause. And depending on what symptoms the patient has, we usually deliver it in the cream with the estrogen, or we can deliver it as a pill. And these are progesterone deficiency symptoms. Also agitation, irritability, anxiety, anger, weight gain, water retention, headaches. Not pleasant at all.
No. Aggressiveness, that's the lady kind of going to knock her boyfriend out or maybe a coworker or something like that. If you're feeling like that, check in with your doctor. Maybe you're progesterone deficient.
And these are more symptoms. So what are some of the causes of low progesterone? Well, you may just have low production. Other hormones may be out of balance, such as having low LH hormones or increased prolactin. You may be under stress, and who isn't under stress these days? A lot of women are on antidepressants. You walk into traditional gynecologists and they ask how you are, and you say, well, I'm not so great, and they give you a prescription for Prozac. Um,
I
excessive.
didn't know gynecologists could do that. Really, that's interesting.
There's
maybe you should get your hormones checked first.
Exactly, exactly. Excessive arginine consumption. So that's also, sometimes people go to vitamin shops and just ask the clerk behind the counter, and they say, oh, take good arginine's good for energy and it's good for vascular, and too much arginine may not be so good for you. That's why you need to be with a professional who knows pretty much what they're doing. Sugar, saturated fats, and again, when you come to Patients Medical, we check your vitamin levels, we check your mineral levels, we check your thyroid, and all these things should be checked before getting hormones.
And just because nutritional supplements seem natural or herbs seem natural, they're still very potent. It's still very dangerous if you don't understand them completely.
I once had somebody who had asthma, and they actually went to the health food store and got adrenalatum. And they wound up on a respirator. They went into respiratory arrest. So you do have to be very careful. Yes, they're good for you, but just like everything else, everything's in balance, and you have to know what that balance is.
And not everything is good for everybody.
Right. Synthetic progesterone, also called progestins. Other names are Depo-Provera. And these are actually made from horse urine. So what are the side effects of progesterone? Well, increased appetite, leading to weight gain, fluid retention, irritability, depression, headaches, decreased energy. So you were asking me why not synthetic? This is why not. Acne, hair loss. A lot of women these days are coming in talking about their hair loss or hair thinning.
So the list goes on. So many.
So as we were talking about before, this is usually how we replace bioidentical hormones, either orally or with the cream.
And where does that cream go exactly?
The cream is usually rubbed onto either your inner thigh for about a minute, minute and a half, or your upper inner arm.
Okay, so it's for external use. It's not something that goes internally.
No, not at all. And these are the things that natural progesterone or bioidentical progesterone does do that is not seen with progestins. They actually interact and help balance your estrogen. They leave the body quickly. They improve your sleep. They have a natural calming effect. They lower your blood pressure. They help you use and eliminate fats, and it lowers your natural cholesterol.
So if you have weight that's just not coming off, even though you have a great diet and you're exercising, this might be something to ask your doctor about.
Absolutely. It also, and probably the biggest question or the most frequent question I get asked for all the time is, what about breast cancer? I heard hormones cause breast cancer. Synthetic hormones cause breast cancer, not bioidentical. And it increases scalp hair, and it's a natural diuretic, and it's a natural antidepressant, Megan.
What's not to love?
It stimulates the production of new bone, which decreases the chances of you becoming osteoporotic. It enhances the actions of your own thyroid. It improves your libido. It converts the bad kind of estrogen into a form of estrogen, that can be eliminated by the body. It protects your brain by increasing myelination.
And here we have a little bit about breast cancer risk again, and that's such a big, that's like one of the main things that people ask about on the phones when they call in, and they're asking about bioidenticals, and they're very concerned about breast cancer. But just to restate, we have not seen an increased risk of breast cancer, and in fact, Dr. DeNise was just saying it's actually protective.
Right. And this is why it's important. You just don't get your cream when you come and leave, and we say, see you in 6 months, see you in a year. It does have to be monitored because your body is changing. So the effects of the hormones are going to be, the amounts of the hormones are going to be changed too. And this is what happens if you take too much progesterone. You increase your fat, your cortisol increases, your insulin resistance increases, which means you're not able to utilize sugar the way your body does. It increases your appetite. You crave carbohydrates.
So even when your estrogen is balanced, if your progesterone is out of balance, this is still going to happen.
Absolutely. And this is testosterone replacement in women. Women need it for an entire sense of well-being. It's not only for libido. It's very important for women's upper body strength. If you notice, your arms aren't as strong if you're carrying in your food packages, or things aren't, you just don't feel as strong. It could be, in fact, low testosterone. And of course, it's for libido, your body composition, your bone density. And what's interesting is DHEA is a supplement that can increase testosterone in women, but not in men.
Interesting.
Other things that testosterone does. And also I want to bring you down to the bottom of the slide, which is it elevates your norepinephrine in the brain, which has a tricyclic, which is an antidepressant effect.
Great.
And these are the things that you feel when you do have low testosterone. Your muscles don't feel as strong. You're gaining weight. You have a low self-esteem. Your skin seems thin, poor, not as elastic. Your hair becomes dry and brittle. Your eyelids droop. Your cheeks sag. Your lips get thin.
So then after you take testosterone, you look like Angelina Jolie, right? Nice full lips.
Not exactly, but you're better off.
Well, if that's what you're looking for, a plastic surgeon can help you with that. But so just plump up the lips that you already have, the nice lips that you already have. Testosterone may help.
And so what are some of the causes of low testosterone? Well, of course, menopause, but also, look, childbirth. Adrenal stress, or as we call it, adrenal insufficiency. Other names are adrenal fatigue, endometriosis, depression, psychological trauma, birth control pills.
And what are HMG-CoA reductase inhibitors? What are those?
Those are chemical compounds that are used for it's the rate-controlling enzyme in cholesterol metabolism.
Okay, all right. So when you're on cholesterol medication, this may be a concern.
Exactly.
All right, interesting. Also, if you've been through chemotherapy, this may be a concern as well.
So we usually treat the low testosterone. I personally usually use only transdermal replacement, but you can have it by mouth. It is bioidentical, but in order for it to work well and not to beat a dead horse, your estrogen and progesterone all have to work together. Because without enough estrogen, the testosterone can attach to brain receptors. And if you give it alone, if you give testosterone alone, it can increase plaque formation in your arteries, causing heart attacks.
So going back to the symphony analogy, everything has to be in harmony, not just fixing one thing or trying to only isolate one hormone.
Exactly. But these are other ways you can raise your own testosterone levels, and we talk about this too when you come in. Decreasing your calorie intake, exercising, getting enough sleep, reducing stress. And zinc has become extremely important in the literature now, which is needed for the metabolism of testosterone. And we, in fact, do test your zinc levels when you come. And what's interesting is when used with estrogen and progesterone, if you also give testosterone, it actually even gives you a lower chance of breast cancer than if you just use estrogen and progesterone, even bioidentical alone. So this is what we were talking about before. You are seen every 3 months. Certainly if you need to sooner, you're welcome to call us at any time. But usually, initially, until we have you in a stable state, especially if you're pre-menopause or peri-menopause and your body's still changing, we're probably going to have to do labs every 3 to 6 months until we get you in a steady state and you're feeling perfect.
To feel perfect. So just to kind of take a step back, the patient experience is when you come in to see the doctor, you're not going to meet with them just for 5 or 10 minutes. This is an hour-long visit with the doctor and possibly a nurse too, just depending on which doctor you're seeing here. And it's a very comprehensive exploratory interview, holistic health history, physical exam, complete blood work, everything that Dr. DeNise has just talked about, all the vitamins and minerals and hormones and many, many other things as well. And then the doctor is going to give you a preliminary treatment plan, just to kind of get you started in the right direction. But they do need to wait until the blood work comes back in order for you to get a bioidentical hormone replacement therapy prescription. And then they can advise you on how to use it. So then after that, you can keep in touch with the doctor's assistant, either by email or phone. And if you're having some issues immediately, definitely let the doctor know so that they can tweak your prescription or give you some advice on how to be comfortable until the hormones finally kick in. And then after that, after you stabilize, keep checking in with the doctor about every 3 months.
Absolutely. And we also take into other factors. We treat you as a whole person. And I think that's so important because we need to know what is your stresses, what is your diet, where do you work, what kind of work do you do, what are you exposed to. All this factors in.
Absolutely. So if somebody is eating burgers like that every day, and they're not feeling so good, it may not be that their hormones are imbalanced. It may be that they could stand to take a smaller burger instead of that big one, or maybe a salad. So we really encourage you to get on track with your health. Kind of any parting words, Dr. DeNise, about bioidentical hormone replacement therapy or people who are concerned about their hormones?
I think if you have concerns, I think the only way to alleviate is by asking you, come visit us, ask your personal questions, bring your personal history, and we can take you as an individual.
Absolutely. A highly customized treatment protocol is what Dr. DeNise and the doctors here at Patients Medical offered. This is not one size fits all. By any means. They are customizing each and every treatment to you. They work with a compounding pharmacist to get a prescription that is tailored specifically to your needs, not anybody else's. And so what would you say to people who are already on synthetic hormone replacement therapy, or maybe they're on birth control or something else? They're on another prescription right now.
Well, obviously, I don't think that's a healthy way to be. These But I will say that bioidentical hormones are not meant for birth control. It is definitely taking a toll on your body, but that's an individual's choice. And, you know, I don't really know much more what to say after we went through the whole presentation.
Sure, sure. Well, I mean, I guess the takeaway here is that if you're concerned about it, you should probably come and talk to a doctor and then see what your options are. And so, yeah, the bioidenticals are probably a much better choice for your health. And if you are concerned about birth control, but you do need that, talk to the doctor about options, because there are options. And it's better just to get yourself associated with a physician before you actually get into trouble with your health.
Well, not only that, but, you know, a lot of young girls, starting as young as 13, are going on birth control today for things like acne. And that's probably not where you want to be. They are definitely taking a toll on your body, and there's a lot of women now in child-rearing years, and the incidence of disease in child-rearing years when you really need to be your healthiest. So that's a big concern for me.
So just hearing about all of your options is the best way to avoid any future imbalance, or minimize the risk. I guess you can't avoid it completely, but minimizing the risk of future problems. And so that's what we're about here, is just preventing the disease before it happens, giving you the options that suit your body and your lifestyle the best, and just getting to know the doctor on a very personal level, and the doctor getting to know you on a very personal level, so that when questions come up, you have a trusted professional that you can get answers from. What I would like to invite you to do is to check out our website. Dr. Vivian DeNise is the doctor on the upper right-hand corner of the doctors there. As you see, we have an entire team of holistic medical doctors. So once you come and get your hormones balanced with Dr. DeNise, we have other physicians too. We have holistic oncology. We have a general practice doctor for people who are just looking for basic coughs and colds that accepts insurance. And we have alternative pain management. We have psychopharmacology. We have homeopathy and acupuncture. So just kind of whatever your needs are, we have a lot of these specialty doctors under one roof who collaborate to create a treatment protocol that works for your whole health, not just one aspect of it. And if you're looking for more information about Dr. DeNise or any of our physicians, you can go to patientsmedical.com and then click on Our Physician. That's the button the second to the left up on the upper nav tab there. And then you can actually watch videos, and Dr. DeNise has a video on her website of her, and then many other webinars that she's done as well. So check into those, and you can also check into the videos and webinars by our other physicians as well. So if you're interested and you'd like to get more information about Dr. DeNise and her practice here at Patients Medical, or if you realize, hey, this is for me, I want to come in and see this doctor and get balanced, start feeling better, or kind of minimize the risk of some of these other diseases that she was talking about, give us a call. The phone number is 212-679-9667, or you can email. The email is actually going to come to me. I'm Megan, and it goes to media@patientsmedical.com. Both of those are listed on your screen there. That's phone number 212-679-9667, or email media, MEDIA, @patientsmedical.com for more information or to schedule your appointment. Or if you just want to hear about what else we have to offer here at Patients Medical, I can definitely give you information on that as well. So I really appreciate you being with us here today. Thanks for spending the time, and thanks for joining myself here at Patients Medical and Dr. Vivian DeNise, and we look forward to connecting with you soon. Thanks.